This is the Pick Your Poison podcast. I'm Dr. JP, ER doctor, toxicologist, and unapologetic lover of all things poison. Want to know what remedy was a byword for treating madness in ancient Greece and was used to treat Heracles after he murdered his wife and children? And what flower contains the same toxin as poisonous toads? Stay right here to find out. This is an interactive story. Will our patient live or die? It's up to you and the choices you make. So lace up your hiking boots and let's get started. Today's episode starts on a hike. It's one of the first warm days of spring. You're out with two friends, serious outdoors types who keep saying things like, "This is an easy hike," as the trail winds relentlessly uphill. Against your better judgment, they've convinced you not just to hike, but to camp overnight. You stick to the trail, conserving energy and promising yourself it'll be worth it for the beautiful view from the top. Your friends keep detouring into the woods, foraging for ingredients for dinner. So far, they've gathered hen-of-the-woods mushrooms and wild carrots. One of them suddenly crouches, brushing the dirt aside, and says, "Hey, come look at this." He pulls up a bright green sprout. "Ramps," the other one says. They add it to the pile. They also gather pine needles and unsuccessfully try to find acorns. An hour later, you reach the end of the trail and admire the gorgeous view. You don't linger long because at this point, all you can think about is dinner. Back at the campsite, you fire up the campfire. Your friends prepare dinner, excited with their wholesome, all-natural bounty. One friend, a passionate photographer, arranges the fresh ingredients in the cast iron pot, takes photographs, and uploads them to his social media. They put the pine needles in a small pot of boiling water to make pine needle tea, and after a few minutes, the air is filled with a woodsy Christmas tree smell. In a larger pan, they add olive oil, salt, pepper, and chili powder to the mushrooms, carrots, and ramps. The delicious smell of mushrooms soon fills the campsite. They pull out some tortillas, fill it with vegetables, and offer you a wrap. You politely decline. To their horror, you pull hot dogs out of your backpack. You stick one on a tree branch and roast it over the fire. The hot dogs are ultra-processed and unhealthy, but most importantly, not foraged. Everyone enjoys their meal, which they wash down with the beer. You rummage in your backpack, pulling out marshmallows, chocolate, and graham crackers for s'mores. They enjoy the s'mores as much as you do, and you joke about their lack of objection to the ultra-processed marshmallows. The fire burns low, the forest gets quiet, and they turn in for the night. You're wide awake thanks to the night shifts you've been working. You admire the stars for a few minutes, open a book you've been trying to read for the past month, and enjoy the peacefulness of the outdoors. The quiet atmosphere is broken, interrupted by groaning. Before you can ask if she's okay, your friend vomits on the ground just outside the tent flaps. She groans again and then crawls out, holding her stomach, and lays down on the ground in a fetal position, saying, "I really don't feel good." Your other friend comes out of his tent, saying, "Yeah, I don't feel so great either." "What's the matter?" you ask. He vomits next to the fire. You dig around in the first aid kit you always carry, relieved to find anti-nausea medicine. You give each a dose of ondansetron, i.e. Zofran, to put under their tongues. It's been less than an hour since dinner, but you say, "Let's pack up and go." You're staying in a state park. Fortunately, it's not far from civilization, but it's still a good 30 or 45 minutes from your homes, not to mention the nearest hospital. Both friends are experienced campers, climbers, and outdoors persons, and they both immediately say no. One says, "I'll be fine with the nausea medicine," and the other says, "It's just a little stomach upset." You don't love the idea of being in the wilderness, even if it's not exactly Death Valley with people who don't feel well. But they're teachers, and they reassure you that a lot of kids have been sick with stomach viruses, and they assume they just caught it at an unfortunate time. Except they don't get better. Your friend is still curled up on the ground. Every time she tries to sit up, she turns pale and starts sweating like she's going to pass out. You put your fingers on her wrist to check her pulse. It's in the 50s. That's low, but you don't know what her resting heart rate is. She's a runner, so it might be pretty low at baseline. It's been about 30 minutes since she took the Zofran, so you give her a bottle of water. She takes a few sips and promptly vomits it up. The other guy isn't doing much better. You check his pulse. It's the same in the 50s. Unlike her, he's not an athlete and probably has a normal resting heart rate in the 70s to 80s. Question number 1. What's the next step? A. Leave now. B. Give them some more anti-nausea medicine. C. Look for rose hips to make tea. D. Look around to see if there's a willow tree. The answer is A. It's not, in my opinion, safe to continue camping. If you said B to give more nausea medicine, you're certainly not wrong. Your friends can't keep anything down, so tea is not going to be helpful. And willow bark contains aspirin, but that's not going to help here either. A basic stomach virus is still at the top of the list, but the low heart rates are weird. Usually people with stomach viruses have a normal or fast heart rates if they become dehydrated. It's not entirely clear what's going on. You decide enough is enough, and at the very least, you should all go back home. This time, when you tell them you're leaving rather than ask, they don't object. They're still throwing up, so you tell them to leave the tents and camping gear and you'll come back and get it tomorrow. It takes some effort to get them into the car. They're both dizzy and they're both worse with standing. They half walk and you half drag them one at a time and get them inside the car. While you're doing that, both have a drop in their heart rates with both of their pulses in the 40s when standing. You punch one friend's address into the GPS with a plan to get them home and into bed so they can rest and recover. As you hit the outskirts of civilization, your friend in the front seat seems kind of sleepy, and her breathing doesn't look right. It's not exactly a medical assessment, but it's hard to see what's happening in the dark while you're driving. Okay, time for a change of plans. You veer off at the next exit, heading for the emergency department instead. This is fiction, so of course, you're the doctor. Your female friend looks worse out of the two of them, so let's start with her. She's 38 years old, she doesn't have any significant past medical history, and doesn't take any medicines or over-the-counter medicines. The nurses check her vital signs, noting the following. Her temperature is 98.6 Fahrenheit or 37 Celsius. Her heart rate is 45. Her blood pressure is 85/55. She has a respiratory rate of 7 and an oxygen saturation of 100% on room air. On exam, she seems tired, not her usual energetic self, but she's answering questions appropriately. Her pupils are equal, round, and reactive to light. Her heart and lungs are clear. She doesn't have any abdominal tenderness, and she has good muscle strength. Essentially, she has a slow heart rate, a low blood pressure, and a mildly low respiratory rate. You order more nausea medicine as well as IV fluids to help with the low blood pressure, then move on to your male friend. He's 36-year-old. He has a history of seizures and is taking lamotrigine, an anti-epileptic medicine. His vital signs are as follows. Temperature 98.6 Fahrenheit or 37 Celsius. Heart rate 50. Blood pressure 90/60. His respiratory rate is 10, and his oxygen saturation is 100% on room air. His physical exam, other than the low heart rate and blood pressure, is again similarly unremarkable. So for him as well, you order nausea medicine and IV fluids. Okay, so what's happening here? Is this a stomach virus? Nausea and vomiting? Yes. But a low heart rate and a low respiratory rate? That's pretty unusual with a stomach virus. Breathing should be normal, and as I said, if anything, you expect a rapid heart rate from dehydration. We have talked before about a vagal response during vomiting that can slow the heart rate down, but it's really weird that it would be happening in two people at the same time. I'm pretty much doubting a stomach virus at this point. What could it be? Well, we know it started rapidly. Both your friends were completely fine, having had way less difficulty with the uphill hike than you did. I don't know about your friends, but when I was in college, I knew a lot of people who liked to camp so they could do drugs. Could this be a drug of abuse? Well, it doesn't really fit with a typical toxidrome. Certainly the slow breathing can go along with an opioid, but she's awake and her main complaint is vomiting, which doesn't fit. Sympathomimetics would cause a rapid heart rate and high blood pressure, something like cocaine or methamphetamine. Hallucinogens definitely cause significant nausea and vomiting, but neither of them is hallucinating. So it doesn't fit, and as far as you know, neither of them does drugs anyway. That brings us, of course, to every toxicologist's worry, foraged ingredients and the reason you brought hot dogs. You yourself do not even have a twinge of nausea, forget vomiting and a low heart rate. You're probably shouting it at me right now, what about the mushrooms? It's an excellent question. You don't need me to tell you there are tons of different poisonous mushrooms causing a lot of different symptoms. Could this be Amanita phalloides, the death cap mushroom? That fortunately we can rule out because the symptoms wouldn't start for at least 6 hours after exposure, except for the one exception I mentioned of Amanita smithianus in the Pacific Northwest. Plenty of mushrooms can cause nausea and vomiting from just mild gastrointestinal upset that passes in a few hours. There are some mushrooms which interestingly cause toxicity when taken in combination with alcohol. Your friends did each have one beer with dinner. Could it be one of those kind of mushrooms? No, and I'm doubtful this is a toxic mushroom at all. Why? Well, they ate hen of the woods mushrooms. These are also called maitake mushrooms, and they're flat mushrooms that look like a shelf. It's pretty difficult to misidentify or mistake them for poisonous varieties like the death cap, which looks like the kind of mushroom from Alice in Wonderland. While I don't recommend eating any foraged mushrooms, given the risks, I'd say it's pretty low and unlikely here. If you listened to the Last Supper episode, you might have some questions, so let me clarify. Amanita phalloides, the death cap mushrooms, can be confused for matsutake mushrooms. The hen of the woods mushrooms are also called maitake mushrooms. And just for the sake of being thorough, there are some mushrooms which cause bradycardia via anticholinergic toxicity, but again, these are single-stemmed mushrooms and not shelf-style like hen of the woods. Bottom line, I'm doubtful it's the mushrooms. What about wild carrots? We talked about what wild carrots could be mistaken for in a prior episode, The Hazardous Hike. That's question number 2. Are they mistaken for A. belladonna, B. poison hemlock, or C. wolfsbane? Wild carrots have been mistaken for both poison hemlock and water hemlock. I'm sure you know this is the toxin used to kill Socrates. Could this be hemlock toxicity? The onset is fairly rapid, and water hemlock causes slow heart rate and a low blood pressure, but one of its big manifestations of toxicity is seizures, so it doesn't entirely fit. Poison hemlock, on the other hand, causes nicotinic toxicity like nicotine or tobacco poisoning, resulting in weakness, paralysis, and respiratory failure. I don't think this is poison hemlock. Water hemlock isn't totally excluded at this point, but I'm kind of doubtful that the wild carrots are the culprit. What about the tea? Tons of people have been poisoned intentionally or unintentionally by toxic tea. What can go wrong with pine needle tea? Well, the vast majority of pine needles are non-toxic to humans, but there is one very serious exception, and that's if the pine needles come from a yew tree. Were there yew trees in the area where you were hiking? You have absolutely no idea. What happens? Well, yew trees contain compounds causing sodium channel blockade, resulting in both fast and slow heart rates. It causes a classic EKG finding from the sodium channel blockade, which is a wide QRS. This can result in cardiac arrest and death. Yew trees are where Taxol, the potent chemotherapeutic agent, is derived from. What about the wild ramps? Wild ramps basically look like green leaves, and they're another thing I wouldn't eat if they'd been foraged because they can be easily mistaken for other green leaves, especially in the spring when many plants are sprouting. What's been mistaken for wild ramps? Lily of the valley is one, and hellebore is another, specifically the false hellebore plant. A caveat here, I'm talking about what can be mistaken when foraging for American plants, and of course this can vary widely across different countries and different continents. Anyway, these are really potent toxins and not ones you love to be applied to potential causes of your close friends' symptoms. Lily of the valley and other convallaria plants can cause a digoxin-like toxicity with nausea, vomiting, and a slow heart rate. That could fit here. I'd probably send a digoxin level to see if there's any cross-reactivity causing a false positive dig level, though that's definitely not a definitive test. A low potassium might also be a sign of lily of the valley toxicity. You order an EKG and labs on both patients. Your female friend has complete heart block, meaning none of the impulses conducted into her heart are getting through and her ventricles are beating slowly on their own. You tell the nurse to apply external pacemaker pads as a precaution. You don't turn it on, but you could turn it on later if her heart rate got lower or if she became symptomatic. Your male friend has sinus bradycardia, not concerning at this point. You're relieved to see that both of them have narrow QRS intervals and that neither EKG shows signs of sodium channel toxicity, making yew poisoning less likely. How are we going to figure out what's poisoning them? Well, unfortunately, not knowing is a common scenario in the emergency department. So what do? Well, first we do supportive care. In this case, nausea medicine and IV fluids. Atropine, a medicine we've talked about before that can raise your heart rate, is worth considering. I'd probably order a dose for your female friend with the heart block to see if it helps, but I don't think the male friend needs it right now. After a milligram of atropine, her heart rate does come up to the high 50s. Is there an antidote for any of these plants? There isn't. We treat based on symptoms, i.e. more nausea medicine, more atropine, an external pacemaker if the heart becomes severely bradycardic. If this is something like yew toxicity or a digoxin-like toxicity that might develop into ventricular tachycardia or ventricular fibrillation, we would treat that according to standard ACLS protocols with shocks and epinephrine, etc. Thinking back to when they were cooking, you do have a guess as to which of these might be the toxin. Which of the following senses might give you a clue as to what happened? That's question number 3. Is it A, taste, B, touch, C, smell, or D, sound? The answer here is C, smell. You remember from the campfire the delicious smell of the mushrooms and the Christmas tree smell of the tea. What didn't you smell? Onions. A classic way to identify the difference between ramps versus look-alike plants of hellebores and lily of the valley is a strong onion smell. Now, I wouldn't stake my health on this, but if the onion smell is missing, those green leaves probably aren't ramps. It should have been easy to smell, especially when cooked over the campfire. You continue close observation, and much to your relief, over the next hour, your friend's conditions don't deteriorate. They do still report nausea, though the antiemetics are helping, and their heart rates are slow, but they're both awake and talking, so far without any evidence of other dangerous arrhythmias. An hour later, your friend is well enough to text the photos of the plants he took prior to cooking to a friend who's a botanist. He calls you into the room, showing you the text he got back. The botanist thinks the wild ramps were not ramps at all, but in fact false hellebore. He says, "Am I going to die?" Is he? You've probably heard of hellebore. It's a classic poisonous plant. It's associated with witches and necromancy. In its early stages of sprouting, the green leaves are easily mistaken for ramps because both have big flat green leaves. The difference, however, is that the false hellebore has beautiful lines called pleats on the leaves. Let me give you a little tip here for plant identification. I've said many times before I'm a toxicologist, not a mycologist or a botanist. I'm way better at treating the patient than identifying the plant that poisoned them. But I do have a nice trick to help. If you take a picture on your phone, on iPhones at least, there's a little symbol at the bottom, the letter I with some stars. And if you tap on this, it'll try to identify the plant and give you some information. It's far from 100%, and I certainly would not eat anything I identified in this way, but can be a useful tool for some helpful information. Is your friend going to die? What does hellebore do? Let's talk about what it is, because I find the entire taxonomy and even the toxicology sometimes confusing. The reason for this is because there are a number of different types of plants that are called hellebore plants. Just to name a few, there are real hellebores, false hellebores, black hellebores, white hellebores, and most of them have really beautiful flowers, and all of them have been used as both toxins and medicines since ancient time. In medieval times, hellebore was used to treat demonic possession, madness, and seizures. And as with much from history, it can be difficult to sort out specifically which plants are being referred to. Many times the plants were divided into black hellebore, which is kind of traditional hellebore species, and white hellebore, which is the false hellebore. I have to share with you this quote, which made me laugh, from a 1653 pharmacopoeia. Quote, "The root of white hellebore, or sneezewort, being grated and up the nose, causeth sneezing, kills rats and mice, being mixed with their meat. It is but a scurvy, churlish medicine, being taken inwardly, and therefore better let alone than used." End quote. True hellebores are in the hellebore family. The word is described from the Greek words hellen, to kill, and bora, food. In the case of our patient, what's been confused for ramps is a false hellebore. These are in a genus called Veratrum, specifically Veratrum viride. What's the difference and why does it matter? Well, true hellebore plants contain cardiac glycosides, a digoxin-like compound, which we normally associate with foxglove. But interestingly, hellebores contain bufadienolol, a helleborine more similar to the digoxin-like substance found in poisonous toads than in the digoxin-like substances found in other poisonous plants. Conversely, veratrum toxins in the false hellebores are things like veratidine and similar compounds. These bind to sodium channels, causing repetitive firing. This means that normal impulses can't be conducted, resulting in bradycardia and hypotension due to overstimulation in the vagus nerve. This means nerves can become overstimulated, and in the case of the vagus nerve, you can get slow heart rate, resulting in turn in low blood pressure due to overstimulation. The medical word for this is the Beazell-Jerash reflex. It's a triad of bradycardia, hypotension, and slow breathing. Question number 4. What other types of problems can cause a Beazell-Jerash reflex? Is it A, a heart attack, B, drowning, or C, spinal cord injury? The answer is A, heart attack can also cause it. The reflex is essentially a response to noxious stimuli in the heart, so a heart attack certainly would qualify. Do you think false hellebores or true hellebores are more toxic? Well, actually, I'd have gotten this one wrong if it was a question. I'd have guessed the digoxin-like compounds in the true hellebores cause more toxicity, like we see with foxglove. But in reality, patients who ingest true hellebores do have symptoms of nausea and vomiting, and sometimes mild bradycardia, but they rarely develop significant toxicity. The veratrum toxins in the false hellebores seem to cause more serious problems. Nevertheless, most patients do recover in 24 hours. There are a few reports of death from false hellebores. In one case, 2 people were found dead with veratrum seeds in their stomach, and there are a few reports from China of death after exposure. Over the next 2 hours, your friend's symptoms disappear, the nausea and vomiting go away, and their heart rates improve back to normal. Fortunately, they're discharged with no sequelae. Despite what happened, they are already planning their next camping trip. You do not plan to attend and sincerely hope there's no foraging involved in this one, recommending they bring hot dogs instead. This is a fictional case, as are all our cases, to protect the innocent, but it is based on real poisonings. In ancient times, hellebore was thought to be a cure for madness. There are so many stories about this that hellebore became a byword for insanity. One famous story is about Heracles, who in a fit of madness murdered his wife and children. Seeking a cure, he was treated with hellebore by a healer in Antikyra, and the city became so famous for having the highest quality hellebore that telling someone to, quote, go to Antikyra meant that they were crazy and needed help. Hippocrates said that those who are mad should be treated with hellebore, and Roman poet Juvenal in the 1st century jokingly said, the whole world needs a dose of hellebore. A surprisingly relevant sentiment in modern times, though please don't take hellebore. It's been used on poison arrows, and there are reports of Greeks poisoning the water supply during wars with this plant. There is evidence of veratrum use in medicine from literally around the world and across time, from Chinese traditional medicine in Russia, ancient Greece, Iran, and by Native Americans in the US. The problem with it is that it has a very narrow therapeutic window, meaning it works, but the toxicity is so high you might kill the patient in the process. It was tried in modern medicine to treat high blood pressure, but it was never approved as a drug because, again, it had too many side effects. Not surprisingly, false hellebore causes severe poisoning in animals, including sheep and cows. So, that brings us to the last question in today's podcast. If we have any vets listening, I'll bet this is an easy one. What is the description of the congenital deformity that occurs if hellebore is eaten early in pregnancy by farm animals? Is it A, cyclops calves? B, monkey-faced lambs? C, the twisted spine deformity? Or D, split stomach piglets? Follow the X and Instagram feeds, both at PickPoison1 for the answer. Remember, never try anything on this podcast at home or anywhere else. Thanks for listening. It helps if you subscribe, leave reviews, and/or tell your friends. Transcripts are available at pickpoison.com. While I'm a real doctor, this podcast is fictional, meant for entertainment and educational purposes, not medical advice. If you have a medical problem, please see your primary care practitioner. Until next time, take care and stay safe.